Next is Maren Schroeder, followed by Chris Hallbrook.
Thank you. You did really close. My name is Maren Schroeder.
I have an off day today. Sorry about that.
You know what? Everyone does it to me, actually.
Thank you.
I'm president of Sensible Minnesota. We're an education advocacy-based nonprofit with a mission to make our neighborhoods safer and more inclusive for those negatively impacted by cannabis prohibition and the war on drugs. My testimony today, the scope of it is I'm going to talk about medical cannabis. So I'll just disclose that we've worked with about 500 patients one-on-one and talked with thousands of patients over the past 4 years. Our opponents to legalization here today will say Minnesota has decriminalized marijuana and legalized its medical use. Yet we're still arresting nearly 10,000 Minnesotans each year for marijuana, over half for possession at increasing rates since medical cannabis legalization. Clearance rates, crime solved, for violent crimes is only 46%, but when it comes to drug crimes, they clear 85%. Medical cannabis is not accessible or affordable. We have low patient numbers and products costing up to 4 times their equivalent in other states. As of last Friday, there were 15,416 patients enrolled in the program. In comparison, New York and Pennsylvania, who both worked from our model, have about 100,000 patients each. Adjusted for population, that's nearly 30 and 40,000 patients respectively. If we had a true patient access model like Arizona, we would have over 150,000 patients in this state protected from law enforcement interference with their health care. Opponents to this bill are the same opponents who helped construct our failed medical cannabis program, one that prevents patient access, doesn't provide it. The same opponents have yet to offer solutions to improve access and affordability for the over 130,000 patients not served by our current program. There are many reasons to legalize cannabis for adult use, and Minnesota is ready. But our organization is focused on patient access. It's personal for us. We're a team of patients, caregivers, and parents of patients. Unfortunately, we're left with what we have today. The best option to truly provide that access to those 130,000 patients is to urgently fully legalize cannabis in Minnesota. Thank you.
Thank you, Maren.